Okay, shall we start with week 2? Is everyone ready? Can I get a yes or no? Okay, as you all can see, the questions are very easy. Okay, before we start, can I know the marks? Like out of 18, what is the score of each one of you? 15 out of 18. Great. 17. Great. Nice. Okay, 15. Anyone else who wants to share their score? Okay. There's nothing to be disheartened even if you get a less score. This is a practice session so that you can do well in your current assignments, right? And learn through the mistakes and try to be more active in the session. Try to attend the lectures and nothing is impossible. You all can cope up with it, right? Okay. 20 people are there, but I can see marks of only 4 students. I don't know, did the rest of you didn't count the marks or you don't want to share it? Okay, that's not an issue. Okay, we'll start with the second week's question. Okay, okay. So the first question is, I guess it is visible to all of you. Some of the nutrients from the food cannot be produced by our body. What are such nutrients called? Essential nutrients, non-essential nutrients, unproductive nutrients, or productive nutrients. Some of the nutrients from the food cannot be produced by our body. What are such nutrients called? Okay, I think everyone knows the answer. There's no confusion in this answer, I guess. It is A, essential nutrients. As it is not produced in our body, we need it essentially from the outside. That is why it is called whatever food we cannot be produced in our body and we need it, it is called as essential nutrients. So, what are the 7 essential nutrients in our daily diets? Carbohydrates, proteins, vitamins and minerals, fats, fiber, and water. Okay, we'll move on to the next question. How many milligrams of choline is required to 1 to 8-year-old children? How many milligrams of choline is required for 1 to 8-year-old children? 200 to 350 milligrams, 200 to 210 milligrams, 200 to 250 milligrams, 200 to 249 milligrams. Okay, the range is very near for all the options. Let's see. Okay, here I'm getting multiple answers. Let's see what is the correct answer. The correct answer is 200 to 250 milligrams is safe for a 250 milligrams of choline is required for 1 to 8-year-old children. So what is choline exactly? Choline is a water soluble nutrient that is necessary for healthy cell membranes and metabolism. It is a part of acetylcholine, which we know as a chemical and which is involved in our memory, mood, and muscle function. It is always important for the infant brain development, specifically in memory and learning functions, as well as overall growth and development. Okay, we'll move on to the next question. The way to diagnose any dash nutrient deficiency is to measure and track the weight, height, and mid upper arm circumference. So, which type 1 or type 2 nutrient deficiency we can measure by tracking the weight, height, and upper arm circumference? Is it type 1 or is it type 2? Okay, let's see what is the correct answer. Correct answer is type 2. I think maximum of you have given the correct answer. So what is exactly type 1 and type 2 nutrient deficiency? In type 1 nutrition deficiency, children continue to grow. There is no stunted growth here. Right? That's why we can't measure the type 1 nutrient deficiency by taking a track of the height, weight, and arm circumference. That is why the correct option is type 2, in which because of type 2 deficiency, the growth of which the child slows down. And what happens in type 1? Tissue levels of the nutrient fall, whereas that in type 2, tissue levels of nutrients are maintained. In type 1, specific symptoms arise as well, through which you can say that this is a type 1 nutrient deficiency. And in type 2, there are no specific symptoms, only the growth of the child decreases. Right? Okay. It is difficult to determine which specific dash nutrient the body is deficient in. Type 1 or type 2? It is difficult to determine which specific dash nutrient the body is deficient in. Type 1 nutrient or type 2 nutrient. Okay, I can see type 2 mostly. Okay, so the correct answer is type 2. Why type 2? Again, here you can see the example of the minerals are magnesium, potassium, sodium, and zinc, and some essential nutrients like water, energy, oxygen. You can't trace that what is deficient, which specific nutrient is deficient in type 2, right? Okay. We'll move on to the next question. Supplements are commonly recommended to correct dash nutrient deficiencies. For which type of deficiency supplements can are recommended and can correct that type of deficiencies? Already I told you the difference between type 1 and type 2. So I hope it is clear now. Okay, I think most of you have given the answer. It is type 1. Okay, we'll move to the next question. Diagnosis and treatment of a dash nutrient deficiency is difficult. Again, diagnosis and treatment of a dash nutrient deficiency is difficult. Type 1 or type 2? All questions are surrounding around the same topic, type 1 deficiency or type 2. If you're clear with these two things, I think you can answer all the questions related to these two type of deficiencies. Diagnosis and treatment of dash nutrient deficiency is difficult. Okay, this was a very direct question again, and the correct answer is type 2. I guess most of you have given the correct answer. The diagnosis and treatment of type 2 deficiency is difficult. Okay, we'll move on to the next question. A dash nutrient deficiency is commonly diagnosed in two ways. First, the unique symptoms of deficiency are recognized. Then, the level of the nutrient in the body is measured by a blood test. Okay, a contradictory question to the previous question. Okay, again a direct question, and we already discussed the concept. So the answer is type. It's type 1. Sorry, this is a typo. It is type 1. Okay. Along with folate, which other nutrients are necessary to prevent neural tube defects? Along with folate, which other nutrients are necessary to prevent neural tube defects? Calcium, potassium, choline and omega 3, vitamin B12 and choline. Along with folate. Anyone can tell me which vitamin is folate? A very basic question. Yes, B9. Great. So everyone is aware of the concepts. That is really nice to know. This way I can think you will get full marks in the assignment, I'm hoping. Nice. Along with folate, which other nutrients are necessary to prevent neural tube defects? Okay. Okay, I know vitamin B9. Now please go back to the question and answer the option. Okay, vitamin B12 and choline. I think most of you have given that as the correct answer. Let's see if it is the correct answer. Correct answer is D. So here you can see the key nutrients that can prevent neural tube defects include B12, folate, riboflavin, choline, methionine, B6, inositol, glycine as well. So along all these nutrients, vitamin B12 and choline are also included. Okay. We'll move on to the next question. How much protein is present in 250 ml cow milk? How much protein is present in 250 ml of cow milk? How much protein is present in 250 ml of cow milk? Okay, everyone is saying 8 grams. Is it? Or anyone has any different answer to give? 9 grams is not an option. Go green. Okay, let's see what is the correct answer. Correct answer is C. Around 8 grams of protein is present in only 250 ml of cow milk. So how nutritious it is, right? What should be taken? 10th question. What should be taken to delay breakdown of cartilage in joints and relief pain from osteoarthritis? What should be taken to delay breakdown of cartilage in joints and relief pain from osteoarthritis? Chondroitin sulfate, keratin, cysteine, or methionine? Which is the correct answer? Whoever is unable to give the correct answers or have a lot of incorrect answers, it's not a problem. But next time, be thorough with the lectures and then come so that we can discuss the assignments more effectively and you can get a lot of answers correct. Okay. Okay. Let's see what is the correct answer. Correct answer is chondroitin sulfate. So, what is chondroitin sulfate? It is one of the building blocks of the cartilage. So, what happens in osteoarthritis that these cartilages in the joints start breaking down, and this chondroitin sulfate might slow down this breakdown. It is a part of the extracellular matrix in our body. It is usually manufactured from animal sources such as shark and cow cartilage. Okay. We'll move on to the next question. It is said that we must include complete proteins in our daily diet. Why? They contain all essential amino acids. They contain few essential amino acids. They do not contain any amino acids, or they contain all non-essential amino acids. Why is it necessary to include complete proteins in our diet? Okay, everyone has given the answer. Let's see. So the correct answer is they contain all the essential amino acids that is required for our body. That's why it is always recommended to keep complete proteins in the daily diet. Okay, we'll move on to the 12th question. What kind of foods, even in large amounts, can satisfy only the feeling of hunger? What kind of foods, even in large amounts, can satisfy only the feeling of hunger? Nutrient rich foods, nutrient poor foods, nutrient dense foods, or whole foods? Start answering. Whoever is raising a hand, please type your query in the chat box. I am seeing it. Okay, some are saying C, some are saying B. Nutrient poor foods or nutrient dense foods? Which is the correct answer? Okay, let's see which is the correct answer. Nutrient poor foods are the ones, even if we take it in large amounts, it can only satisfy our feeling of hunger, but they are nutrient poor, that is, they won't provide any nutrition to our body. But they can satisfy our feeling of hunger, like the junk food we take. We keep eating junk food. Okay, moving on to the next question. What is another name for type 1 nutrients? What is another name for type 1 nutrients? Growth nutrients, functional nutrients, non-functional nutrients, or conditional nutrients? Think properly and answer. Don't get confused between type 1 and type 2 nutrients now. Okay. Type 1 nutrients are growth nutrients or functional nutrients or non-functional nutrients or conditional nutrients. We already discussed this question, but the concept of this question, and still you people are giving the wrong answer. I think so. Some have given growth nutrients as the correct answer. They are wrong. The correct answer is functional nutrients. Type 1 nutrients are known as functional nutrients. Okay, we'll move on to the next question. What is the another name for type 2 nutrients? We all know that now. So, we already discussed, right? Type 1 nutrient deficiency and type 2 nutrient deficiency. So in type 2 nutrient deficiency, we saw that if there is a deficiency in type 2, there will be slower growth. So type 2 nutrients should be growth nutrients, right? And type 1 nutrients are the functional nutrients, as they affect the functioning of our body. They don't affect the growth of our body. So type 1 nutrients can't be growth nutrients. Type 2 nutrients are the growth nutrients. Okay, I already told the answer to this question. The correct answer is growth nutrients. Here you can see the classification of nutrients. Nutrients can be classified into four categories basically. Type 1, type 2 macronutrients and micronutrients as well. So what are the type 1 nutrients? All vitamins, most trace elements, calcium. And type 2 nutrients include nitrogen, sulfur, essential amino acids, potassium, sodium, magnesium, phosphorus, zinc, etc. Okay, we'll move on to the next question. In type 2 nutrient deficiency, is the appetite affected? Appetite increases, appetite reduces, appetite is not affected, appetite is affected only in a type 1 nutrient deficiency. What happens to the appetite if there is a type 2 nutrient deficiency? Whoever is raising a hand, please type your query in the chat box. Is everyone done answering? In a type 2 nutrient deficiency, is the appetite affected? Appetite increases, appetite reduces, appetite is not affected, or appetite is affected only in a type 1 nutrient deficiency? I can see only 3-4 people answering. What are the rest people doing? Please be active. Will only help you in practicing the questions and you can solve your assignments in a better way, as well as we are revising your lectures as well, right? Because I know the current year assignment questions will be different from what we are discussing now. It is all over a revision of the lectures. Okay, let's see what is the correct answer. Correct answer is B. I think most of you have given the correct answer. Appetite reduces due to type 2 nutrient deficiency. We'll move on to the next question. A child has severe type 2 nutrient deficiency. Mother increases the quantity of the previously given food without improving the quality of the food. Will it help? Yes or no? A very simple question. Will it help if you improve the quantity of the food but not the quality of the food? Okay. Everyone is done answering? Correct answer is no. If you just increase the quantity of the food but not the quality of the food, you can't complement the nutrient deficiency in your child. Okay. We'll move on to the next question. Food fortification is used to prevent or treat which nutrient deficiency? Type 1 nutrient deficiency or type 2 nutrient deficiency? food fortification is used to prevent or treat which nutrient deficiency? Type 1 or type 2? Okay, let's see what is the correct answer. Correct answer is type 1 nutrient deficiency. So, what is fortification exactly? Fortification is the practice of deliberately increasing the content of one or more micronutrients in our food, that is, vitamins and minerals, to improve the nutritional quality of the food supply and provide public health benefit with minimal risk to health. So, by increasing the nutrients in our food, we can cope up with the type 1 nutrient deficiency but not with type 2 nutrient deficiency exactly. Okay, we'll move on to the next question. Presence of dash is important for the absorption of vitamin B12 in the intestine. Presence of dash is important for the absorption of vitamin B12 in the intestine. Insulin, intrinsic factor, phytates or oxalates. Okay, let's see what is the correct answer. Most of you are telling intrinsic factor. Yes, intrinsic factor is the correct answer. So, what is the intrinsic factor? Intrinsic factor is a glycoprotein which is secreted by the stomach, our stomach, which enables the absorption of vitamin B12 in our intestine. Okay, we'll move on to the next question. Vitamin B12 deficiency may go unnoticed in vegetarians due to excessive intake of folate, vitamin C, protein, or iron. Vitamin B12 deficiency may go unnoticed in vegetarians due to excessive intake of folate, vitamin C, protein, or iron. People are joining now, but I'm not sure why, because it's my session is already going to end. But whoever have joined late, I can inform you all that these sessions are being recorded and you can again go through the questions from my YouTube channel. And I think NPTEL will provide you the link of the YouTube channel as well as the presentation folder link will be shared with you as well. Okay, so whoever have missed the session, they can again cope up with by watching the recording sessions. And I request again that in the next week, Tuesday, please be prepared. Please watch the lectures at least one time and come so that you can have an idea of what we are going to discuss today and you can answer the questions more actively, right? Okay, let's see what is the correct answer. Correct answer is folate. If we take lot of vitamin B9, that is folate, our vitamin if we have a vitamin B12 deficiency, it may mask it, it may go unnoticed. So vitamin B9 is important in red blood cell formation and for healthy cell growth and functions. Even if we have vitamin B2, B12 deficiency, we may not notice it because of if we are taking excessive amount of vitamin B9, it will keep our cell functioning healthy. Okay. Let's see. Deficiency of vitamin B12 may go undetected in vegetarians. Reasons could be the same question again, but just choose the option. Their diet is rich in iron, which will improve their strength. Their calcium rich diet, which will make their bones stronger. Their folate rich diet, which will mask the deficiency symptoms. Their diet is rich in vitamin B12 foods. This is a repetition of question, just the framing of question is different. But I guess now all of you know what is the correct answer, right? So the correct answer is C. Their folate rich diet will mask the deficiency symptoms. So with this, we are at the end of our session. We still have 5 minutes for 8 o'clock. Does anyone have anything to say? Any feedback for today's first session? This is our first session. We are going to have session for the rest 12, 11 weeks. Will there be a new link shared each week? No. This is the only link. This is the only Google Meet link. And through this link only we will interact every Tuesday 6 to 8 p.m. You can save this link and always join on Tuesday 6 o'clock and we can have a discussion session as well. Is there any feedback to improve the session? It is most welcome. I'm sorry today's session was a little fast paced because we had a lot of questions to discuss. But from the next session, I'll try to keep explanations a little more for each question so that we all can have a more informative session as well. Ma'am, where can I see the recorded video? Now I'm recording this session. I'll soon upload it in the YouTube and I will share the link with the NPTEL and they will share the link with you. I think maybe in a day or two, you will get the link for the recorded session as well. Okay, that's great if you all are happy with the sessions, but I'm always welcome for any suggestion or feedback to improve the session or if you want anything extra. The thing is, we can't discuss the lectures again. Yes, I will. I don't have to share the recorded. Okay, I will share. I can share the recorded video in the next week if you all want it. But I'm saying that I'll share it with NPTEL after I upload it in the YouTube, and you can watch it from there. I'll share the YouTube link from the next week, and you can just go to that channel and record the and see the recorded sessions as well. That won't be an issue. Yes, yes, don't worry, you all will have the recorded sessions. We'll get the recorded are not same like in lecture 12 video. Key importance of selenium but notes is calcium and vitamin. Okay, I am not sure about this problem because I don't handle these things. These are handled by Rupal ma'am. If the lecture notes and lecture videos are not same, please try to convey her. But see, I'm not even if the lecture notes and lecture videos are not same. I think that you should go with the videos and like the assignment questions. Are the assignment questions matching with that week? Then it is okay. I think so. Maybe there was some mistake in the uploading of lecture notes, although I am not in management of that. But if go through the lecture videos. I will say that. Yeah, assignment questions are matching, so there must be some issue with the lecture notes. Yeah, if videos are matching, just listen to the videos and try to solve the assignment. And sometimes there may be problem in the notes. That's not an issue. Anything else? Anything else, or should we discuss? Yes, I request everyone to please be on time so that we can start by 6:15 or 6:20. Even video is about selenium and vitamin A. Okay, I'll go through it. What is the problem going on? For week 0, the answer for question 1, what is wasting, is wrong. Kindly, okay, I'll try to convey this to ma'am. If the answer is wrong, I'll try it. Okay, sure. Anything else? Do you people don't have a way of communicating with Rupal ma'am? I'm not sure of that. I'm only accountable for the live sessions I'm taking, so I'm not sure if I can do this, but I'll try. Anything else, or should we disperse for today? 2 hours it is. Okay. HT is the right answer. Okay, I'll try to contact ma'am and tell. I'm not sure if I can share the email ID, but okay, I'll try to contact her and ask her. Okay, okay, we'll disperse now. It's 8 o'clock. We'll meet again next Tuesday at the same time, 6 o'clock. The link is same. And okay, we'll have an interactive session next week for week 3. Okay, all of you, please be prepared. Okay, bye. Thank you, everyone.